Estás viendo Canal América, televisión dominicana para el mundo.
A Time for Truth show is sponsored by the Office of Dr. Bernard Fialkoff, a periodontal, dental implant and laser specialist in New York City, for over 40 years. Dr. Fialkoff was honored by the International College of Dentists and Pierre Fauchard, and received the Presidential Lifetime Humanitarian Honor from the White House. Call us at 718-229-3838.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. I'm your host, Dr. Bernard Fialkoff, and it's a pleasure to welcome you back again tonight. Many of you have been asking how you avail yourself of our shows. It's actually very simple. Go on YouTube, A Time for Truth show, and you click subscribe and you'll be availed of all the previous programs that we've had. And tonight I want to get right to it because we have a very special guest, and we'll be dealing with a cutting edge technology regarding dementia, Alzheimer's, other diseases, and something that probably most of us don't even think about. So let's get right to it. And Buddha, if you put his pictures up on the screen, I want to introduce our viewers to Dr. Scott L. Rosa, D.C., B.C.A.O., President of the Trauma Imaging Foundation, Vice President of the R.W. Sweat Research Foundation, Chairman of the Research Studies Group, Upper Cervical Chiropractic Practitioner in New York State for over 30 years. He is an honorary fellow and diplomate in craniocervical junction procedures, a Palmer College graduate, board certified Atlas orthogonist from Sherman College Chiropractic. The doctor holds a master's in Whiplash and Brain Traumatology from the Spine Research Institute of San Diego, a certification in low-speed automobile crash reconstruction, and graduate degree from the Center for Research into Automobile Safety and Health, CRASH. Dr. Rosa has spent the last 15 years working developmentally with the inventor of the MRI, Dr. Raymond Dementia, and Phonar Corp upright multi-positional MRI in developing his advanced dynamic imaging procedure and treatments. Dr. Rosa is renowned for landmark findings regarding whiplash patients and presented at the Craniocervical Junction at the Karolinska Institute of Sweden and the American Academy of Orthopedic Medicine Conference in Florida. He's also presented at the North American Spine Society Convention, the International Whiplash Trauma Congress, Toro Osteopathic College, the ICA Convention in New Orleans, and the International Chiropractic Association. Dr. Rosa has co-authored articles on restoration of normal cerebrospinal fluid flow, whiplash and related disorders, brain injury, the craniocervical syndrome and MRI, the craniocervical junction syndrome, cervical spine injury following whiplash, resolution of cervical complications, secondary to motor vehicle accidents. And we have so many of those in today's world. How many people are probably suffering after those accidents? And the treatment of cervical spine, obstructions of cerebrospinal fluid flow. He was awarded the Upper Cervical Research Chiropractor of the Year by the ICA An engineer, if you will, let's bid a warm welcome to Dr. Rosa to A Time for Truth show. Welcome, Doctor.
Thank you for having me.
Oh, thank you for taking the time. You have so much to offer. I want to get right to it, but I want to ask you a few questions about you. How did you decide to start on a chiropractic career?
I actually was having a problem with a converging eye. My mother worked for an ophthalmologist for 30 years, and the ophthalmologist wanted to do a surgery to shorten the muscle, feeling that that would help the converging eye. And I went and had my first chiropractic adjustment, and that ultimately ended up correcting the problem and never needing the surgery. So anything that can prevent me from needing a surgery was something I became very interested in.
I can totally understand. And then, so you became a chiropractor, and there's so much that we want to talk about tonight, so I want to get right to it. What inspired you in the craniocervical spine field?
So I actually, when you go to chiropractic college, sometimes you donate your body to science. And as colleagues go ahead and learn how to do adjusted procedures, sometimes those adjusted procedures can be a bit irritating. And I had just started interning in my first semester in chiropractic college with a doctor that had been doing work in the craniocervical junction in terms of treatment for over 40 years. He's one of the great masters, Dr. Crowder. And I had gotten a manipulation that unfortunately was a bit irritating to me. And I had asked him if he would be kind enough to treat or correct my craniocervical junction misalignment. And upon doing so, I was getting treatment very frequently, sometimes 2-3 times a week. And his first treatment lasted 3 weeks. The second one went 3 months. The third treatment lasted 9 months. And I went on to graduate and realized that was the direction and type of procedure that I wanted to practice because it worked beautifully on me.
Interesting. And what is the lymphatic system? Because I read a lot of your articles and I saw that quoted. I think it's important for our viewers to understand this from the beginning.
Yeah. So again, in my background, I'm pretty extensively into research on head neck trauma, health of the brain, as it pertains to things like neuroinflammatory conditions and neurodegenerative conditions such as MS, Parkinson's, Alzheimer's, dementia, even autism. We're in research with autism. So my research started where the health of the brain is dependent on 3 systems. That's what keeps our brain healthy. The first system is the blood to the brain. The blood brings the nutrients into the brain parenchymal cells to continue to keep the brain healthy. The second system is the spinal fluid, what's called cerebral spinal fluid. It was originally thought that cerebral spinal fluid was there to just cushion the brain and hold it up in your head. But researchers at the University of Virginia and University of Rochester put a chemical tracer in that spinal fluid and found out the spinal fluid's not just there to cushion the brain or hold it up, it's actually there to wash away metabolic waste and toxins. So the spinal fluid's job is to move those toxins or mobilize them after they're produced from either trauma or normal function, and then it deposits those spinal fluid toxins into what's called the venous system. And then the venous system is what drains out all the toxins from the brain as well as the spinal fluid. You might have heard about the chronic traumatic encephalopathy that football players are suffering from. They talk about tau proteins. Well, those are proteins that are inflammatory to the brain. So if any one of those 3 systems, whether it be blood, spinal fluid, or venous outflow, if any of those are impeded or obstructed, it can start to not allow the brain to be an environment of creating or keeping good health. It can start to create an environment of inflammation, which kind of limits or decreases or kind of mitigates the brain's ability to heal when there's trauma. And the research is showing, not just ours, but all the other researchers, it's showing that the lymphatic system, the term is used for the glial cells of the brain. That's what we have in the brain. We have lymphatic system, which are the lymph nodes that clear out toxins when you have the flu. So the lymphatic system was termed as the ability of the spinal fluid to wash away the metabolic waste and toxins. And anything that slows it down or impedes it is what can create an environment of ill health of the brain. So what we do is that area, the craniocervical junction, is my area of expertise in terms of alignment, and it's malalignment in that area that can create what we call a virtual choke point. It's like a crimp in a hose. And if the fluid can't get out of the base of the skull and meets the misalignment at the base of the skull, at the craniocervical junction, the mitigation of that fluid moving in and out is what the research has shown to be able to create an environment that could be inflammatory to a patient's brain and or left over time can lead to degeneration. That's what the researchers have shown.
Very interesting. And I see that you did also a lot of work with MRI and advanced imaging. And
Yes.
tell us a little bit of why that was, what it does, and the implications for patients in terms of their diagnosis, their treatment.
Thank you. So I've been in practice 35 years, and the first 15 years or so, maybe a little bit over 10 years, I would send patients out that were having problems in their head for MRIs. The MRIs would more often than not come back saying unremarkable, meaning there's no tumors, there's no bleeds, there's no fractures, and so forth. The problem was that the imaging was not answering the questions of how come these patients were deteriorating neurologically, and there was kind of a disconnect. So what I did was that I took this program, as you mentioned in my bio, the brain trauma and whiplash program, very extensive, one of the finest in the world. And I learned that oftentimes the trauma can go ahead and create issues in the brain that traditional imaging was kind of falling short in diagnosing. So what we did was that being that the imaging was not sufficient enough to connect the dots, so to speak, of the patient's clinical symptoms relative to what the MRI showed, I went ahead and realized that most of the imaging done today, if it's a brain MRI, it starts from the base of the skull to the top of the brain. If it's a neck MRI, it starts from the second cervical disc and vertebra down. The craniocervical junction is between the base of the skull and the second cervical disc. So what was happening is that most imaging studies that were being performed never looked at the craniocervical junction. So I was introduced to the inventor of the MRI, Dr. Raymond Donadian, a dear colleague and friend of mine. We sadly lost him last year. He passed away. But I went to him and explained to him at the time when we met that the imaging was just insufficient in imaging that region. And he graciously said to me, "We're happy to help. Why don't you bring some patients down and we'll see what we can do to help you." Because at that time, this go back in probably early 2000, at that time, the state of the art of imaging was falling short of imaging that area. So I went ahead and brought 3 patients down, true story. And they put the patient in the scanner and the technician looked at me and said, "What do you want to image?" And I said, "The alar ligaments, which are ligaments that stabilize the craniocervical junction." And the technician looked at me and said, "What are those things and where are they?" So I literally realized I had to build the arc from scratch. And that's when I went in and started pioneering. I did dissection, I did research to try to figure out how do we image that area with precision and sensitivity to see the structures and the problems that get created when that area is injured or damaged. And subsequently, we spent years and years and years developing and refining these protocols that eventually we've developed. And now we're able to see the area with clarity and very good detail. And every week we have patients that come in from out of state and out of the country. And I go and I meet them at the imaging facility personally. I physically direct the scan with our imaging protocols. And we've been able to benefit many patients by giving them the dignity of a diagnosis. Because when traditional medicine sometimes will look at the MRI when there's no pathology in the brain, they'll say you're normal, there's nothing wrong with you, you might be anxious and depressed, you might need some antipsychotic medication. And more often than not, that is not the case. It's really that they have a problem that we know how to visualize with the sequencing and the scanning methods that we've developed.
Very interesting. And there's a video that you sent me. Engineer, if you can put that video on, and I think that would probably be a good segue, because when I was watching it, I really was amazed at what you were able to do with this former NFL quarterback who actually I was a great fan of when he played football. And you have that video ready, engineer? Yes. Okay, let's play that video, please.
First time they did this procedure, within 2 minutes, it was like the toilet flushed. I could feel this stuff actually leaving my brain. My eyes cleared up, my speech cleared up.
The left is before, the right is after. So you see how much there is there? See how there's less in here? Instead of all this white stuff being in there, you're seeing more brain tissue than fluid. So it's already started to brain. Over the next several days, it'll improve more.
It's amazing. Jim McMahon. So tell us a little bit about that story and, what he came in with. I know he had tremendous pain, and I was watching the whole video, but I wanted you to discuss it. Go ahead.
Yes. So actually, Jim McMahon was referred to me by the inventor of the MRI. Jim had been contacted because he was on the front cover of Sports Illustrated about 8 years ago, suffering from early onset dementia. So Dr. DeMaden contacted me and said, "Do you think you can help?" I said, "I'll certainly do everything that I can." So the story with Jim was that he had obviously in his career multiple concussions and traumas to his head and neck. There was one incident where he was actually dumped on his head by another player. So when they went ahead and as he started to progress on after retiring from football, for 4 years before he came to me, he was complaining that he was mostly living in a dark room. He had ice picking type headaches on both sides of his brain, and he couldn't leave his house essentially. If he left his house, he would have to have his ex-girlfriend, on speed dial to be able to come get him because he couldn't remember how to come home. So he was deteriorating both functionally. He basically lived in a dark room and didn't come out very often other than to bathe and eat. So when they brought him up, we went ahead and we scanned him. We found he had a very, very severe misalignment, more than most, at the base of his skull. And obviously, after we did this gentle alignment that we practice, and of course, no pressure on me, I had the inventor of the MRI in the room. I had Jim McMahon. I had Jim's girlfriend. We had all these very high-profile people. And we aligned Jim, and then I put him to rest. And I stepped out of the room for a few minutes to look at another patient. And when I came back in, the inventor of the MRI, Dr. DeMaden, said, "Jim, tell Doc what you're feeling." I said, "Jim, you okay?" He goes, "Yeah." He goes, "The ice picking pain I had in my head?" I go, "Yeah." He goes, "Well, that's pretty much gone." And I said, "Really?" And he said, "And the brain fog that I had?" I go, "Yeah." He goes, "That's pretty much gone too." And I said to him, "Jim, there are no miracles, but that's a good start." And then subsequently, we've continued to treat him. And Jim, we used to have to send a car service to pick him up. He comes in about every 3 or 4 months to get treatment. We used to send a car service to pick him up, but now as he's healed up, he can fly into Newark Airport, rent a car, drive up to see me, and drive back. So it's a wonderful restoration of a gentleman who was really close to taking his life. He's on video stating, had he had the opportunity and had something in his home, such as a rifle or a pistol, he might very well not be here today if it wasn't for the ability of us to diagnose him, to find a problem, treat him, and now, God bless, he's doing wonderful.
It's an amazing story. It's so important for those athletes out there or friends of people who've been in trauma to realize that you have this treatment available to you with Dr. Rosa in upstate New York. And so tell us about your latest research on neurodegenerative brain disease and concussions.
So obviously, as I mentioned, my practice is kind of focused. Probably 90% of my practice are patients that present with head and neck trauma. It can be anything from car crashes to football injuries to soccer and so forth. So we treat pretty much the most complex type of cases that we are around. So to that point, what we've noticed again, as we've done this research, when I first started out doing the research, we knew that the patients felt better after treatment, but we didn't understand why. But then we started doing these before and after MRIs, kind of like you saw in the video there. And what we found is that when the patient was malaligned, we found that the fluids that we just spoke about, the blood, the spinal fluid, and the venous blood was not moving very well. And then subsequently, we found after treatment, it started to move properly. And of course, the patient started to improve in terms of their clinical symptoms. So what we started to do is we started to say, you know what? Most chiropractors treat patients that have MS and Parkinson's. as I have for 35 years. But when we started seeing that the treatment was bringing about nice changes, then we started using the imaging to validate what we found before treatment and how it improved after. So that became the catalyst for me to say, you know what, maybe we need to start looking at MS and Parkinson's and dementia and Alzheimer's under research guidelines and see how what we do treats them when they say they feel better. So that has led on to us doing extensive research in the field of MS and Parkinson's. We're actually getting ready to do a very robust retired NFL study. And we're hoping, if our hypothesis is correct, and I'm working with a top concussion neurologist who's run 30 concussion clinics. We're working with a microbiologist. We're working with an epidemiologist, a radiologist. We've got a group, a cadre of great colleagues of mine. And we're of the opinion, if we are correct in our hypothesis, if you've heard, the only way to diagnose chronic traumatic encephalopathy, what the football players are succumbing to, what the veterans that are succumbing to when they come back from being, in Iraq or Afghanistan, if we're correct, we're going to be able to screen for the problems that many of them don't get the opportunity to screen. In other words, the only way to diagnose CTE or chronic traumatic encephalopathy is on autopsy. We believe if our hypothesis is correct, that we're going to be able to diagnose them or screen them early and intervene before it gets to the terrible point that it has in so many of these players and patients.
That's a fantastic solution. What I wanted to ask you, I saw in the video you were using like some kind of little like gun or something that was going boop. And what is that?
So it's not a handheld instrument. It's called the Atlas Orthogonal Percussion Instrument. That is the instrument that we use for realignment. We don't use any cervical manipulation. We don't twist or snap the spine. What we do is we use the MRI and X-rays to get the exact measurement of the disrelationship or malpositioning of the cranial-cervical junction spinal joint. And then we take those measurements and we put them into what we call a work factor or an adjusting vector. The vector is the angle at which we position that instrument that you saw in the video. And then that instrument created at the appropriate angle, measured by the MRI and the X-ray showing us exactly where the bone is displaced, is what we use to apply a gentle mechanical tap. It doesn't poke the neck. It doesn't push the neck. You don't feel it. It's using a mechanical tap that's very light and very efficient. So what we're doing is what your field does when you want to go ahead and restore dental occlusion by doing, braces or various other means. So that instrument, again, uses a very gentle force, a gentle tap, mechanical tap, and the patient lies in a fetal position, and they lay on a head support, and then we bring the instrument behind the earlobe where the atlas, first cervical vertebra, is located, and that's the one we apply that gentle force to do the realignment. Very simple and safe.
Very, very interesting. So then the alignment or the exact place that's placed on, it has a lot to do then with your clinical experience on exactly where to position it then.
Yes, if you can imagine, like you might use cone beam CT or dental X-rays to evaluate occlusion. So I use the MRI protocol that I've pioneered. We use X-ray as a basic form of malalignment, looking for it. But the MRI and X-ray is two-dimensional shadow, and MRI is three-dimensional thin slicing through the cranial-cervical junction. So what I do is I do the scan, and then I get the images that show the disrelationship of the bones, and then I print them on a piece of paper, and I take the measurements of the malalignment of those bones, and then I go ahead and I create what we call this vector, the angle at which to position that instrument, and that vector allows us to gently, precisely, like brain surgery, replace the bone into its normal resting place for restoration of good alignment. And that's essentially what we do.
That's amazing. Now, do you teach this in the chiropractic schools here in New York State, or is this being taught, or still in research? Or
so thank you. So I am an instructor in the 3-year, 300-hour diplomate program that's put on our version of the AMA. Is called the International Chiropractic Association. So I'm one of the instructors in the 3-year, 300-hour diplomate program. And then we have the Atlas Orthogonal program, who we sadly lost the inventor and creator, Dr. Sweat. Dr. Roy Sweat was the creator of the Atlas orthogonal procedure. Sadly, we lost him about a year and a half ago as well. But there are Dr. Sweat's son, Matthew Sweat, Dr. Angelo Colavita, and Dr. Dennis Fiorini were the doctors chosen to teach the Atlas orthogonal program. And then I come in to help them, and then I teach the imaging portion of the program and the research that we're doing. So I'm helping the other ones continue on our program since Dr. Sweat's passing.
Wow. Well, this is really amazing. You know, I've had a lot of friends who are chiropractors, and I want to ask you a question because I know chiropractic was kind of like under attack maybe 15 years ago or 20 years ago, or I don't know if it still is. But obviously, from what you're doing now, the tremendous benefit that this man, I'm sure this man had been to many, many different health professionals without getting a resolution, and you resolved the case for him. So has this changed the perspective now on chiropractic from other health professionals?
That's a great question. Yeah, the original statement that you mentioned about there being this kind of disconnect between medicine and chiropractic, that was back in the 80s. I was in chiropractic college when that came about. That was resolved. And to be honest with you, because of the imaging and the models that we're using, the medical profession at large really understands the model that we present to them. To the extent that I've been honored to be a presenter at many medical conferences, I have many medical colleagues that refer patients to me every day. What it is that by showing the imaging and educating them about things that they were never taught, it's become resonant with them. We published a chapter in a medical textbook. Respectfully, there's 8 chapters. We're the only chiropractic chapter in the book. As of 2 months ago, that chapter had been downloaded over 10,000 times, where the top medical chapter, no disrespect, I think the top was loaded about 1,700 times. So our observations, our research, our work, what we're doing has become very resonant. So in my world, I have numerous medical colleagues that all they wanted to know from me was 2 things to create our professional relationship, and they had a right to ask. One was, is what you do safe? Because no medical physician of any type wants to refer a patient to someone that might end up hurting them. That's obvious. And then the second question they ask is what you do efficacious? Does it work? And thankfully, respectfully, because of the work that I've done in the research and the imaging we can show before and after, that imaging demonstrates to them that what we're doing is scientific, it's very safe, we do it very carefully, with sound logic, and it's become resonant with them as well.
Well, you know what? It's been a pleasure to have you on the show. Unfortunately, you know, we've run out of time, but it's been a tremendous amount of information. I'm sure there's people out there who now have some hope. And I want to tell you something personally is that, you know, I am a dental surgeon, but aside from the cases I get of trauma in my own office, people with pain, I also do a drug education program. And as you were saying, some people turn to drugs because they have so much pain or they get addicted because of the pain. And so it's fantastic to now have this new technology that's working. So I want to thank you for being on the show.
Thank you very much. It was quite an honor. And as I leave, respectfully, to your point, we get a lot of patients. We're usually the doctor of last resort. And many of the patients, while they come to us, are having a laundry list of drugs that really, you know, we respect the need for drugs as a rescue initially, but we try to get to the genesis of the problem. And in many cases, the cases that we accept, and we don't accept everybody, we do a vetting process. But if we feel that they have craniocervical syndrome, which is resulting from that area being injured and malaligned, then we offer the treatment and the scanning. And we're very comfortable and very pleased with the outcomes that we're getting. And we also work with other practitioners too. I work with TMJ specialists when there's trauma. It's your field. We work with doctors that are doing regenerative therapies when there's instability and things that come about from trauma. So we work as a cadre or a group of physicians together to help those patients.
Well, it's a pleasure to have had you on the show. For those of you watching, if you have a problem, you're looking for help, find Dr. Rosa in upstate New York. Thank you for being on the show. And until next time, have a very good night.
Thank you, Dr. Fialkoff. You as well.
It's been a pleasure.
This show was sponsored by A Time for Truth Foundation Incorporated as a community service.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got. The world takes you down. You just keep moving on. Let your feet